parliamentarians and their understanding of the propagation and protection of human rights as advocates of decriminalization in the public health response. Well, the meeting, jointly organized by the SADC Parliamentary Forum and the AIDS Rights Alliance of South Africa, ARASA, brings together MPs, civil society, human rights activists and development partners to discuss how to boost parliamentary advocacy for the removal of health-related criminal laws using a human rights perspective. Well, for more, we're joined in studio by Mr. Manish Goben, a Mauritian MP and a member of the Executive Committee of SADC Parliamentary Forum, and Ms. Michaela Clayton, the Executive Director of ARASA. Good afternoon and welcome to you both. Thank you so much for taking time out of what I know is a very busy schedule to join us this afternoon.
Good afternoon, Kirsty. Good afternoon to all your viewers.
All right, let's start with you, Mr. Goben, first up. Drawing up laws and legislating in response to the HIV is a core element of global HIV strategy. But tell us why it's so essential, why it's crucial that we have a human rights-based approach, not only when it comes to complying with international law, but to also effectively combat the disease.
Yes. You rightly mentioned the international norms which we have to comply. But it's more than that. It's not only, we should understand that international norms do not exist in a vacuum. Evidence shows that the path of criminalization leads to nowhere. It boils down to a question: how do we want to treat our people? Do we want to continue criminalizing? Do we want to continue the stigmatization? Or do we want to close the doors of healthcare to people suffering from a disease? Or do we want to open the door of healthcare? Do we want to remove the stigma? So this is why we say at the SADC Parliamentary Forum, which is a regional bloc of 14 countries, that we need to harmonize our laws to get it in the human rights aspect of things and not a criminalization aspect. That's a fundamental difference, and this is what we are gathered here in Johannesburg to share experiences of the 14 countries and to harmonize and to look at the evidence which shows that criminalization in fact has the reverse effect of getting people on the ground, of getting them off the health care institutions, and this is what we do not want to do. We want to open the healthcare, we want to give treatment and achieve what we want. It's the broader picture. It's a disease. We need healthcare. We need all sorts of other accompanying measures, like for needles, methadone treatment, therapy, for example.
Yes. Michaela, let's bring you in here. How challenging is it right now to leverage the kind of political commitment that we need to drive the change that Manish is speaking of?
I think that for me is one of the critical questions, is how do you move the agenda forward? I mean, just to give you an example, this morning we've been sitting in a fantastic meeting with parliamentarians from around the whole of SADC, talking about really controversial issues, or issues that are seen as controversial. Men who have sex with men, people who inject drugs, sex workers, whether or not one should be criminalizing HIV transmission. And, you know, in the last couple of years, I think there's been an amazing shift amongst parliamentarians in terms of their willingness to talk about these issues and their increasing knowledge and understanding of these issues. For me, the critical question is, how do you get it out of that room from parliamentarians sitting together and talking back into the parliaments at a national level? And I think it is all about political will, and I think it's often very difficult. I think it's easy sometimes for MPs to sit in a room together and talk about issues, but taking that back into national governments and trying to push the agenda forward at a national level, I think is often more difficult because there's more resistance at the national level. And that's something we have to get past. We've got to get to a point where the discussions we have in these kind of fora can take place in national governments as well, in national assemblies.
Manish, one of the critical issues that Michaela is exploring or touching on is the issue of the LGBTI community that was under the discussion this morning already. Now, gay and lesbian people or the community in Mauritius have pushed for protection against discrimination. But what is the status when it comes to Mauritian legislation on that? We know that there was a gap in the law a few years ago where it wasn't legal or illegal to be a homosexual on the island.
Yes, very, very good question. Thank you for that. This is precisely one of the goals of the meeting, is to exchange experiences between countries, and the SADC Parliamentary Forum provides a wonderful platform for that. Mauritius, indeed, we need to clean up our statute books, and there are lots of provisions dating back to the colonial days which we need to look at. And the best way to do it is to look at the experiences of the 14 countries in the SADC and then revisit our existing legislation. And this applies to all other countries as well. There is something which I liked this morning during discussions, and I heard it from a senior MP from South African Parliament, and this is true for all countries. Persons, LGBTI persons are our brothers and sisters. How do we treat them? Diversity means we have to include them in our society. We can't shun them. So we need to stop the stigmatization, open the doors of healthcare, and that can only be done through proper legislation. And if we need to clean up our statute books, then we have to start.
Michaela, if I can bring you in there very quickly, what are some of the factors, do you think, that may reinforce homophobia, and what are the major issues that the LGBTI rights, for those sort of rights on a regional level?
I think a lot of the homophobia that does exist, and it does. I mean, we can't ignore the fact that homophobia in many countries in the region is rampant. And I think, there are a number of arguments that are used to justify that homophobia. One is that this is not an African thing. This is a Western agenda which is being brought into our countries in the region. There's cultural arguments. This is not part of our culture, so we can't tolerate this, and we can't, we just can't tolerate this kind of behavior. That plays out in so many different ways in the day-to-day life of LGBTI people, in terms of quite apart from the laws that criminalize same-sex sex, and those, as was just pointed out, are colonial laws. So it's really funny that the argument is, we're pushing a Western agenda by pushing LGBTI rights, when in fact the laws that are undermining the rights of LGBTI people are actually colonial laws. But quite apart from the fact that same-sex sex is criminalized in so many countries, in addition to that, it's the way that people are responded to. You go to a healthcare setting, and nurses won't want to assist because they don't approve of this kind of behavior. So in healthcare settings, you're rejected. In workplace settings, very often people are rejected. In home and amongst friends. And it's not just about rejection, it's about violence. I mean, the levels of violence against, in South Africa, for example, the levels of corrective rape against lesbians, it doesn't just happen in South Africa. It happens in a lot of different countries in the region. So the way it plays out on a daily basis is huge. And it's not just about changing laws, it's about changing attitudes.
Very quickly, Michaela, Seychelles MP Dr. Patrick Hermine, his address being labelled as provocative by some, but really exploring some very hard hitting issues at the core. How subsequent criminalization, like Manish mentioned, drives more and more people underground and just exacerbates the problem. Now, he called it an epidemic of bad laws, and I'm quoting here, saying criminalization is a recipe for a public health disaster, unquote. Is he being alarmist, or does he have a point? Your thoughts?
He's not being alarmist at all. He has a completely valid point. It's not just about, when he's talking about criminalization, he's talking about a number of different types of criminalization. So the first being criminalization of transmission of HIV. Many countries in the region have adopted specific laws that specifically criminalise HIV transmission, laws that criminalise same-sex sex, laws that criminalise possession of drugs and drug use, laws that criminalise sex work. All of those laws, all of those criminal laws, have the effect of driving these populations away from the healthcare services that they need, away from the prevention services that they need. And unless we address those laws and get rid of those criminal provisions, we are facing, a complete tragedy, and that is not alarmist at all, a complete public health disaster.
Thank you so much to both our guests for your time on the SABC News Desk. Manisha, I know you have a lot more to add, and I wish you well on your continued work, the both of you, during the course of your stay in South Africa. On that note, let's move on to some other news.